With the Texas Lyme Alliance, and we wanted to get together today, Dr. Wilson and I, and discuss persistent Lyme and congenital Lyme. I think these are two big parts of the controversy in Lyme disease, and with his retirement coming up here in just a couple of days, I wanted to come out to Denton, Texas, and send a big thank you to Dr. Wilson for all the great work that you've done over the decade, and
to grab me by the feet as I head out.
Yeah, exactly.
Right. Okay.
Give me a good shake and send us all on our way. But he was my original Lyme doctor when I first got diagnosed in 2012, and he was wonderful. Got me real far. So anyway, I've known him for quite a while now, I guess 7 years.
Yes.
And that whole experience was very nice because he's got a great sense of humor. And that always really helps when patients
really have to have something, like that.
You certainly do. You definitely have a certain personality that makes this all work for patients and for the doctor relationship. Right. And so I just wanted to say thank you for all the many years that you stuck your neck out on the line for families to get better.
Very kind. It's such an important thing for me in my life to do this. I was semi-booted out of my first practice for this, retired and came back in 2011 to start treating Lyme again. But it's a blessing to keep doing it up to this point, and I'm fortunate to have somebody to take my patients and to carry on what I've been doing.
Yeah.
So that really helps a lot. But let's talk about, you want to talk about persistence?
Yeah, let's talk about that first. So I thought it was really important with the PTLD from its side of things, always in the news about moving words around with PTLDS and PTLD. And so I thought it would be the most important thing today to address the two things that we need the most help with now, and that's getting rid of this nonsense of the controversy in the science aspect.
Okay, well, PTLDS is a fallacious manufactured diagnosis.
Right.
And it was first propounded by IDSA to not have to deal with the fact that people still had symptoms after they had 3 weeks of doxycycline, because that was not appropriate for them. So they didn't want to go any further with that. So what can we invent to say, well, they're really not, because their tests are negative, they really don't have a disease anymore, they just have symptoms.
Right.
Okay, so that was, in order to make that work, they had to come up with something, and that was called post-treatment Lyme disease syndrome. And so syndrome is it's a fictitious diagnosis.
Yeah.
Okay, so, but they have made that stick because they don't have to follow patients. They don't have to treat them after a certain length of time. So that's kind of where that has been, and made after the 3 weeks or a month or even 2 months of antibiotics in a chronic situation, people continue to have horrible symptoms, and or if they get a little bit better, then they start getting worse again. As far as they're concerned, it's not a problem to them.
Right.
It's all part of that post-treatment stuff.
And also to note, some of the doctors that were involved in that original acronym are rheumatologists who treat symptom type things. So I think from a patient or a mom perspective, I'm looking at who wrote this study, who did this study, who published this study, whose hands were in the pie, so to speak. So
Sure.
I think that's important when you consider junk science versus faulty science versus good quality peer-reviewed studies and science that counts.
Well, what we do know is, let's say on persistence, there's well over 700 publications on persistence in animals and in humans. 700 reports, okay?
And that's at ilads.org, correct?
Yes, you can get all, if you want to read through that, you're welcome to do it, but they're there.
I've seen them, yeah.
Okay, so the fact that people say, or physicians will say on that box side, that there is no such thing as chronic Lyme. So
Right.
the C word has been a real problem. So we've sort of adopted late Lyme in place of chronic Lyme.
Okay.
Just because that's what I use when I dictate.
Okay.
I use late Lyme because they can't do anything about that, because it doesn't have a time frame on the other end of it.
Okay.
Okay, so when I see, the only patients that I see are chronic. I rarely see anybody that's under a year.
Wow,
Okay?
yeah.
And everybody else has been suffering for multiple years.
And the reasons are detection stinks and
Lab stinks.
knowledge in the medical community
Ignorance
is
is
horrible.
not bliss.
I think,
Because you've been there.
yeah,
You know that if it takes an average of 15 physicians to even get to somebody who can make the diagnosis, or if a physician bothers to test, they don't know how to interpret the testing.
interpret the test is a big one.
Right, and they don't know what to treat with.
Yeah.
And so they have to go, what do we do? So we look up, okay, it's 2 weeks of doxy or 3 weeks of doxy, and then that's all I have to do, and everybody goes to the infectious disease doctor if they're not better.
Yeah.
That's an acute situation. That's what most of the primary care doctors say. But the chronic cases are the ones that get lost.
Yeah.
And after they've been through 100 doctors and have been through rheumatology and psychiatry and every place else to try to put those symptoms together, nobody does. So it's like that great Indian parable about the blind people feeling different parts of an elephant.
Yeah.
Okay, so this is a tree, this is a snake, no, it's an elephant. So
It really needs to come together.
Yeah.
The science, the treating physicians need to come together, and I'm really hoping that with you meeting with me from time to time, hopefully we can do this more than once, but that we can get more information out about how patients need help. And this has been an ongoing 30, 40-year struggle for this patient group. What do you think is the most important thing right now that people can do to get help?
Okay, well, getting physician help is the most difficult thing.
Yeah.
What I've seen with my patient population is that since 80% of them are female, and that's true across the United States, they keep pounding away on the internet until they figure out that this looks like Lyme.
Yeah.
And they've made their diagnosis. And going to some doctor doesn't help. So what I have told people is that they might consider, if they're suspicious about this, they can challenge their suspicion with Cemento and Banderol. And if they get a die-off reaction, keep going.
Okay.
If you can't get anybody else to treat it properly,
Yeah.
or treat it with prolonged antibiotics and know what they're doing, you can treat yourself in many ways.
Yeah.
And I use Cemento and Banderol as a diagnostic tool if there's a question about what these symptoms are all about. And I
That's
use
smart.
And I
Yeah.
use it at the end to do some street sweeping and clean up what might be left,
Yeah.
along with the stevia and stuff. But persistence is real, and there's multiple studies that show that. So thinking any other way is ridiculous.
Yeah.
So, but you have to protect yourself. If you get doxycycline, you still have symptoms, you're not done.
Right. Right. And your body is talking to you. If you still have pain and you're doing a protocol, and just my personal experience, but 2 months is my rule of thumb. If that pain hasn't changed, moved, or ended, then we need to change something up. And in treating, a multi-systemic thing, we have to come at this very gently and from a lot of different angles. So that's why he's mentioning some of these natural things. So it's really great.
Because it may be the only thing that people have to use.
Well, affordability is a really big issue. So I came out with the Love a Lyme campaign this month, and I've called around different resources that offer IVs, HBOT, ozone, because these are the treatments that most Lyme disease patients can't afford, because a lot of them are struggling already because they didn't realize how sick they were until, they're desperate for disability because they can't work. So some of this stuff is really important for them to hear.
I've always been so impressed with the physical toughness of women
Yeah.
and the emotional toughness. I have patients who have been chronic Lyme for years and years, but they've had two or three kids,
Right.
all of whom have problems.
I have 4.
You have 4, so
Yeah.
you're fighting through trying to get enough energy to take care of them, and you choose them first over yourself.
Yeah.
And that creates a real mess. And when I see patients like that, I said, you've got to start treating yourself because you won't make it to the end.
Right.
Okay, so there are natural things out there. If you can't get proper treatment, you can get proper treatment with good protocols with cimentobanderol or a combination like that, stevia, oregano, food persisters, and
So thanks for joining us, everybody, and we're going to come right back and talk about the other one a little more in depth.